Welcome. NSG 423. Study Section 5. In-Service Education and Continuing Education. Introduction. In this study section, you'll be introduced to the nature of in-service education, method of in-service education, the need for in-service education, and roles of the nurse in in-service education. The purpose is to increase awareness of the teacher's responsibilities as a professional person. Learning outcomes. When you have studied this section, you should be able to explain the concepts in service education and continuing education. Describe the nature of in-service education. Explain different methods of in-service education. Explain the roles of nurses in in-service education. Concept of in-service education and continuing education. In-service education has been viewed as a teaching and learning process, at the same time a tool for supervision both in service and education settings. Its philosophy is based on the promotion of optimum client care. In-service education connotes continuous education. It is a planned education that takes place while an employee is in the service of his employer. Education occurs while the employee is holding a job. It is deliberately planned. It excludes graduate and postgraduate education, but where this is subsidized by the employer, it becomes in-service education. It is also defined as education delivered in a structured setting that enables one to become more competent professionally, to further develop technical subject matter, competencies to keep abreast of and, if possible, ahead of change, and explore educational and technological contents and process in varying depth and to extend personal competencies. In-service education is an institutional activity provided for one reason only: to improve the equality and productivity of the institution. The way an in-service program is carried out may foster the growth and development of the employees and give the individual employee a sense of self-direction, achievement, and even self-actualization. Purpose of in-service education. The superior classroom teacher or the leadership staff of a good in-service program seeks to maintain the following condition: create an atmosphere of warmth and acceptance, generate feelings of acceptance and value of the individual by authority figures as well as by peers, involves the entire group in self-selected aspects of common problems, orients new members, values differences of individuals, thus encouraging each to develop unique skills and abilities, share all plans for change and new development, encourages interaction with other individuals and groups. Functions of in-service education. The following functions have been identified. It is designed to retrain people, improve their performance, improve their communicative ability, to get them started on the never-ending continuum of education. In addition, in-service education also permits increased delegation of authority. That is, from the employer's point of view, an employer can reappoint the employee to a higher post after his training to utilize the newly acquired skill in the new post. It promotes good morale among administrative personnel, which in turn influences staff. The new appointment or delegation boosts the employee's morale. It lessens the amount of direct supervision of staff. It provides a broader selection of possibilities for promotions, helps to develop individual and appreciation of service and objective of the institution, meets employees' needs for preparation for advancement when they are unable to obtain preschool formal education. Types of in-service education program. Orientation program. Viewed as part of in-service orientation, is a means of getting the new employee by acquiring him with his surroundings. Orientation is the first of the three categories of in-service education. It sets the stage for the period of association between the hospital and the nursing employee, enables one to become acquainted with physical layout of the institution, promotes good human relationship, enables new employee to settle down, enables one to be aware of the aims and objectives of the institution. Skill training. This is designed to teach new procedures to personnel or staff who is already fully qualified at a skill level. Often, it usually involves learning how to use machine, e.g., cyclope designed for quadriplegic lens to prevent pressure sores. A nurse trained at private hospital without such sophisticated machine has to learn the use and operation of the machine when transferred to teaching hospital. Another type is dialysis machine. The nurse has to be taught and supervised in the use of such machines, then she continues to learn the job. It is mostly associated with training nursing auxiliaries. It also implies a little theory as well as practice in skills to bring a person up to a specific skill level from another level. Often, it is a substitution for a formal course, and the type of education provided is technical education. That is, they teach mostly skill in addition to a little theory. Continuing education or staff development. This is the final category of in-service education, the most sophisticated name given to in-service education. The goal is to keep current with advances in the occupational career field, provides technical and professional education necessary to keep up with current technical advances, provides education to satisfy man's aesthetic needs. Individual is developed to his highest potential in intellectually, curious to know what is happening, using one's initiative about development in one's career. It is used for staff in the higher cadre in most places of work. It takes various forms. Methods of in-service education. Formal course. Formal course is one of the most commonly used in service education. It may be 6 or 9 months course, maybe 1 year, 18 months, or 3 years. Numbers of years depend on the type of course, maybe locally, nationally, or internationally. At the completion, a certificate is awarded. It involves a lot of financial layouts. The employer pays for your accommodation, fees, feeding, transport, exam fee, books, etc. Workshop. As an essential technique of an in-service teacher training, workshop is organized with a group of 10 to 25 persons having shared problems in order to develop the psychomotor aspects of the nurses regarding practices and innovations in the area of nursing education. Depending on where you are going, the type depends on area of specialty, that is school or clinical setting. If in school, competency development or improving curriculum, workshop may last a week or month, during which modern techniques are taught or new items or objectives. Workshop may be out of hospital setting. A certificate of participation is issued at the end of the 2 or 3 weeks workshop. It involves some capital outlay, that is paying for refreshment, transport allowance, etc. This differs from institution to institution. There is opportunity for staff to carry on and improve on what they have acquired. It may be organized monthly or fortnightly. Less expensive. It may take forms of units, film show, demonstration, seminar. Beliefs of the American Nurses Assessment about in-service education. In-service education develops nursing personnel for the purpose of improving quality care. Nursing service administrator has the responsibility and obligation to initiate and promote in-service education and recognize that its contribution is important to nursing service. It must be an integral part of nursing service for it to be effective. Adequate qualified personnel and material resources should be provided to run the program. In some places, there is always a unit in charge of in-service. Philosophy and objective of nursing department should serve as guidelines. The individual has a responsibility to seek his or her personal growth and development by participation and cooperation in continuing education program. The professional nurse has a responsibility and obligation to share knowledge and skills with others through the process of teaching. This should increase productivity and job satisfaction. Where an in-service unit is to be established, all people going to be involved should be brought in to participate at the planning stage, and the personnel allocated to that unit should make evaluation from time to time of the program. Setting up in-service education program. In setting up in-service education program, the following questions should be asked. Is the in-service unit going to be within or without the institution or both? What are the aims of the program? What are the purpose of this program from administrative points of view? Which categories of staffs are you starting with? What are the financial implications? Study section summary. In this study section, you have been introduced to the concept of in-service education, method of in-service education, the need for in-service education, and functions of in-service education. North has roles to play in ensuring establishment of in-service education program in their establishment and in ensuring growth in nursing service through personal growth and development by participation and cooperation in continuing educational program. We've come to the end of study section 5. Thank you.